Okay, so like I said, my name is Xola Tatubana. I am the Community Engagement Officer for the Desmond Tutu Health Foundation, the LGBTI division. I am originally from the R and the very nice and small, dusty streets of the Northern Cape. Single child to two loving parents, and I am an activist by heart. So basically, that's me. Okay, so part of the Desmond Tutu Health Foundation, the LGBTI division, Grooteskeer, we run hospital clinical trials unit, which is in South Africa. Our work includes clinical trials, qualitative studies, health promotion, and advocacy. And our aim is to promote equitable access to appropriate and affirming healthcare for the LGBTIQIA plus community through research, community engagement, as well as advocacy. So our trials are, we are currently recruiting for MSM and transgender women and men for Purpose 2, a PrEP trial comparing a 6-monthly injectable PrEP, which is lenacapavir, to daily oral tablets. And that is basically the study overview. It's a double-blinded study. So many transgender trial participants have obviously complex psychosocial issues, and we have found this, that some of those issues are some are living in shelters, or some have experienced some form of rejection, either from family, society, or their peers. Also, no financial support whatsoever, and not accessing transgender health services. So therefore, the need for social support became very stimulus to us, and we have employed a social worker to provide psychosocial support and assist with referrals to gender-affirming healthcare within our transgender clinic here at Grooteskeer, but also with other organizations that we do work with, which is the Wits Clinic at Belleville, as well as the Innova Health Institute in Greenpoint. And we have established a transgender safe space as a key peer-led social support initiative. And this is basically a space where all trans or gender diverse for participants, either in our trials or within the communities that we serve, can come together, share lived experiences, and become a sisterhood of one another, and have that form of, friendly support within one another. So our peer-led safe space is formerly known as Queer and Active. So Queer and Active meets once a month here at Grooteskeer. Our members are also trial participants and other members of the trans community at large. So we basically started in July, and we started with 17 people, and we quickly grew to a total of 50 members, and we are continuing to grow because there is so very much need for a sisterhood support or a peer support from one another. And this is showing at in each and every of our meetings, because we always have new faces, always meeting new people that are coming into the spaces. Q&A members receive a small amount of funds for refreshments and transportation back and forth to their houses. And the group has elected some office bearers and have developed a strategic working plan for 2024. So how diversified is the space? So in our space right now, we have about 30 people who are transgender women and 4 transgender men, and we have 10 non-binary folks, 2 agender people, and 4 gender fluid people. So barriers to accessing healthcare, or some members have no access to gender affirming healthcare, or have had to some point or at some level. Some members still face challenges such as no facilities near where they live that provide even the basic hormones, no funds to travel to either to Belleville or to Cape Town, as well as discrimination and lack of access at local healthcare facilities, and the need to further investigate barriers to access and interventions to overcome them. So right there we have Chadino, who is our chairperson, and next to her is Tamara, our deputy chairperson, and we have the lovely Bushe, who is our treasurer, and Narahi, who is our PR officer, and Bula, who is our organizer. So the Queer and Active Action Plan for 2024 basically is, capacity building, both for the members who are within the space as well as the members who are not necessarily part of Q&A. Social and material support for the LGBTIQ people living in shelters, health system change for the LGBTQI plus, inclusivity in public sector, especially focusing in healthcare facilities, health advocacy to promote greater access to gender-affirming healthcare, empowerment events for the trans and gender diverse community, as well as research to inform barriers and facilitators to accessing gender-affirming healthcare. And we have seen much growth within this space, and this is part of the interventions to doing research around the barriers to accessing healthcare. We had a healthcare, LGBTI Healthcare Day in Central Karoo at the beginning of this year, and that's myself in there with the lovely Lulu Abrahams, as well as Mamsi and Nana and Mia from the Central Karoo. On the panel and discussing, some of the issues affecting the LGBTI, more especially trans and gender diverse individuals. So, in conclusion, engagement by transgender people with queer and active has been substantial and quite indicative of, and as we have seen, an early establishment of queer and active groups in Beaufort and Prince Albert, following our LGBTI plus healthcare workshops that we've held at the beginning of this year. And the future aim is to create a people's movement led by transgender and diverse individuals to advocate for social inclusion and widespread access to gender-affirming healthcare. And thank you very much. I suppose my 15 minutes is up.